This is Where We Live on Connecticut Public Radio. I'm Lucy Nalpathanchel, broadcasting remotely. Congratulations, parents. You've made it through more than 2 months of another school year in a pandemic. The question is, how will the rest of the year turn out? There have been dozens of COVID cases and school closures around our state, and the worst may not be behind us. Today, Where We Live, it's been a couple months since we've heard from the leader of Connecticut's Department of Education on the show, so we asked him to join us to answer our questions and yours. Here's the number, 888-720-9677. That's 888-720-WNPR. You can share a comment on our Facebook page or find us on Twitter at Where We Live. Dr. Miguel Cardona is the Commissioner of the State Department of Education. Dr. Cardona, welcome back to the show.
Thank you for having me. Glad to be here with you.
Now, last time Governor Lamont was on Where We Live, he told me schools should not be closing down completely when there are one or more COVID cases that have appeared. So now that we're in November, how would you say schools have adapted to the challenges of managing COVID positive cases when they happen, Commissioner?
Yes, I'm really proud of the work that has been done in our districts to manage and make sure that they're working closely with the local health departments to reduce any type of spread in schools. As you know, the cases that we're reporting, we're not seeing that they're spreading in schools. They're communities cases that are coming into the schools. So I'm really proud of how they're doing. We have more cases, obviously, than one or two in some communities that come into our schools. But the response from the educators and the local health departments has been exceptional.
Let's talk about the number of COVID positive cases in our schools, Commissioner. How many have there been to date?
Sure. So, I'm looking at sheet in front of me. As of 11/5 last week, there were 457 new student cases. And I think it's important that the listeners hear that when we report cases, we're reporting cases that are happening in all models. So that includes cases that are being reported by the school system for students that haven't ever walked into school. So these are students who are fully remote students. Of that number, 457, 83 of those were students whose families chose remote learning. There were 215 cases of students that were in the hybrid model and 158 cases of students that were in-person model. There are 457 cases, as I said earlier.
Now, did you say that the number of cases that have popped up within school districts, did you say that your data show that these children aren't catching COVID in schools? It's outside school?
Right. I mean, there hasn't been any studies that have examined that in 100%. So, when I share this, it's based on the anecdotal data, anecdotal information that we get from contact tracers who are the ones calling the families and calling the students to find out where these cases are happening or where they might have gotten it or where they might have been exposed. And by and large, the exposure has been traced back to community events or sporting events that the students or staff members have been in attendance. And, we would know if there was spread in a community if multiple members of one cohort come down with COVID or it's spread within a classroom of confined cohort. We're not really seeing that. Doesn't mean that it can't happen. It doesn't mean that there haven't been cases that maybe spread between classmates or adults within a building. But what we're hearing from the contact tracers is that these cases are happening in the community.
As we're talking, Commissioner, just late last week, the Connecticut Department of Public Health saying that 68 Connecticut towns are on this red alert level. So there are at least 15 cases per 100,000 a day. And there's another 44 towns on an orange alert. And so when we think about the number of cases rising in our state, hospitalizations are now going up. Is there a scenario, a metric where the state would again mandate that schools close statewide?
Mm-hmm. So there could potentially be a time where the governor and our health department feel that efforts like what took place in the spring are needed. We're not at that point now. You're absolutely right. The numbers are going up and, we have to be vigilant. But we also know a lot more about COVID-19 than we did in the spring. If you recall, March 12th, pretty much everything shut down, because we didn't know much about how it spread or what strategies are best to mitigate them, we've learned a lot. And we know, and I mean, the first 2 months of school is evidence of that we're able to function in a school with mitigation strategies being utilized effectively, and it's not spreading, right? So I think those things have to be taken into account also to make sure that we're not ignoring the need for our public education students to go to school and the benefits that they get from schooling in person.
You said that there may be a point where schools would have to close. So, what is, again, that metric? I was looking at the DPH town level framework for these red alerts, orange alerts, yellow alerts. And in the red column, Commissioner, it said, in collaboration with local health department and superintendent, consider more distance learning above 25. What does that mean exactly?
Sure. So, the townwide alert system says that at 15 cases per 100,000 for a 2-week period, you should start thinking about closing things or reducing the number of people that are in a location at one time, partly because you want to maintain the service of public education as long as possible. In the education addendum 4, which is all public information, if you look on our website, you'll see that 25 cases per 100,000 is where we're recommending, based on input from the local health department who helped develop all of our addendums. You should start thinking about what are those factors in your local community that need to be taken into account to make a determination whether or not more students should be learning in a remote fashion. And it could be the density of the neighborhood. It could be factors such as access to testing or fidelity of implementation of mitigation strategies. Those are some of those things that have to be taken into account at a local level when decisions are being made about reducing density in schools.
Mm-hmm. You're hearing Commissioner Dr. Miguel Cardona. He leads the State Department of Education. You can join our conversation at 888-720-9677 or find us on Facebook and Twitter at Where We Live. Before I move on, Commissioner, again, as we hear from the governor and others about cases rising, we're hearing that indoor gatherings should be less than 10 people. And so how do you reconcile that guidance with the fact that you've got all of these students in school with staff?
Right. No, that's a very good question. A lot of people ask that. Part of the reasons why we're asking folks to limit your gatherings is so that we can maintain our schools, so that we can keep our schools open, because we know the negative impact it has when we were fully remote for such an extended period of time. These mitigation strategies that the governor spoke of are intended to keep the services that we know are critically important for communities, such as hospitals, safety, fire and police and paramedics in schools, keeping them functioning. With that said, we also know that the mitigation strategies in our schools are being implemented very well, probably more so than most other places. We have high schools running where students are adhering to the facial covering requirement, probably more so in our schools and then in many other places in the community. And I think the message from the governor and the Department of Public Health is really intended to address those areas where we are hearing that there is more spread. We're hearing that there's more spread in family gatherings when people are coming together and saying, well, you know what, I know this person, they don't look sick, I can take off my mask. That's not happening in our schools, and it shouldn't be happening in our schools. That's kind of why you see that difference there.
Well, I have to ask, you mentioned that you're not seeing in communities across our state a point where schools should be closing down fully, but then we have the city of New Haven, which the students were remote from the very beginning. They were supposed to, I believe, start opening today, but we heard from city and school officials that there will be no in-person learning. I mean, how do you respond to that particular city and the approach its school officials have taken?
Sure. So New Haven and Danbury students have not had the opportunity to participate in-person learning. I should say the majority, because in New Haven, there have been students that have attended, students with high needs. I visited New Haven a couple of weeks ago, met with their leadership team. And I've had frequent conversations with their mayor, who also has been a big proponent of giving students an opportunity to learn in the classroom. With that said, the conversations between the mayor, the superintendent, and the local health director, based on more recent data, make them less confident that they should be opening schools. Today was the day, and they have to make those decisions locally based on local factors. With that said, I felt that New Haven students should have been given the opportunity earlier on when the infection rates were under 1% if the buildings were ready. And I know that they were working really hard on getting those buildings ready. I believe they were ready last month, but the rollout time was agreed upon to be today. Unfortunately, they were not able to meet that. On the contrary, what we saw in Danbury is an effort to get the students into the schools early on, but there was a spike, if you recall, in Danbury back when school was starting. So they made the right decision to hold off to make sure that they control the spread before bringing students into the schools. Unfortunately, the cases are very high in Danbury still.
If you have a question for Dr. Miguel Cardona about how online schooling is going or the hybrid plan in your school district, the number 888-720-9677, or find us on Facebook and Twitter at Where We Live. I'm looking at a story from Connecticut Public just the other month at a state legislative informational hearing. Representative Doug McCrory said that attendance in large school districts is very poor. Kids are not signing on. And so in instances where you have a hybrid model, Commissioner, what do we know about how engaged students are this time around?
Mm-hmm. Yeah, Senator McCrory is absolutely right. And I think, it underscores the importance that we have to place on giving students an opportunity to learn inside the schoolhouse when it's possible, when you can do so safely. There is no substitute for in-classroom learning. And what we did, Lucy, is we set up a new system that didn't exist before to look at the attendance in our schools and the enrollment in our Connecticut schools. This system took a little while to build up, and I applaud the districts for, we were hounding the districts to get their data on student enrollment and student participation. And we're able to see what Senator McCrory said, that the issue of attendance and enrollment and engagement disproportionately affects our urban centers in our communities that are a little bit more dense or have greater need. So, those data really reinforce some of those strategies of us trying to, where possible and where we can do it, give students the opportunity to learn in-house. But we're also tightening up expectations and guidance around what remote learning looks like. Because we know in some communities when you cannot learn in person due to the spread, we need to have a quality program. And we've provided guidance, Addendum 12 in particular, that talks about what remote learning should look like. Lucy, we want to make sure that if we do have to go remote, the experience for our learners is better than their experience in the spring. So that's part of the goal. But absolutely, we have seen that attendance in our needier districts is the worst, and we're working to improve that.
And so when we look at New Haven again, tell me what you're seeing in terms of absenteeism and the fact that there aren't students that are engaging with the online work, Commissioner.
Right. So, we're in constant communication with New Haven at least once or twice a week. My team meets with their leadership team, not only with student engagement, but also with food insecurities. We know for many students, accessing breakfast and lunch happens in schools. And if you're learning totally remote, the question becomes, are they having access to meals? So we're working to develop a system, a more robust system in New Haven to get meals out, either using buses or community support partners. But in terms of attendance, they have been able to distribute technology and get students logged on, but maintaining those students and the students' engagement is going to be it's going to be a lot of work, and not only for New Haven, but for other districts. So in New Haven, more so probably because those students haven't made those, haven't had the opportunity to learn in their classroom. So everything has been done online.
Kevin's joining the show from Salem. Kevin, what's your question for Commissioner Cardona?
Yes, thank you for taking my call. I come from Salem. It's a very small town. We have about 4,000 people. My question's about the status that we're in. We keep going between orange and red. With only 4,000 people, if we have one person with COVID, we're over the number that you're calling it red per 100,000. How do you rectify that?
Sure. Thanks for the question, Kevin. If you recall, when we initially rolled out our Addendum 4 and the color coding system, it was done based on county by county for that same reason that Kevin brought out. So we encourage for example, the health partner, the local health director of that area, it might be a regional person, should really be looking at the data not only from Salem, but also from the surrounding county. We know that there are no walls around Salem, so people move around. You really need to take into account not just your local community, but the in many cases, the county you're in or the neighboring communities that you're a part of. And I think local health directors do that best. They know where the traffic is. They know where the residents live. So in conjunction with the superintendent, those conversations are happening at a local level.
And before we run out of time, Commissioner Cardona has to leave us in just about 8 minutes. But, I have to ask, when we think back to students at risk, and you said that children belong in school, your data from the State Department of Ed show that homeless children, they're not showing up at a greater rate than a year ago. I believe not showing up for 2 out of every 9 days. So what will the state and districts do to respond to these children?
Right. The pandemic has exacerbated access gaps and opportunity gaps in our state. And by putting these data out and making it as transparent as possible and working with our partners from the superintendent's groups to the boards of education, to the teachers unions, to the families and community partners, we have to really problem solve together. But the first thing to do this is to look at the data and say, where are these students and why are they not attending? What are we doing to reach out to those students in different ways? In many cases, these students also have housing insecurity. They have food insecurity. So some of those basic needs need to be met, and we can work in partnership with our sister agencies at the state level, but also the local community agencies that can help these families get back on their feet so their children can access school.
So can you give me an example of how you're doing that? You mentioned partnering. So if we're talking about the children that may be impacted in, say, Hartford or Bridgeport, like how are you hoping to connect with these children that have the housing insecurity?
So we're part of emergency support function groups at the State Department of Education. We're part of ESF 6. So that deals with food insecurities and with access to healthcare as well. So we're working with the local health director. So as a state agency, we're working with our sister agencies on communicating at the local level with their corresponding agencies. So for me, it's the Board of Education. I'm thinking of New Haven, for example. We work with the New Haven public school system to see how they can work with the local nonprofits there or the local food banks there, the local transportation companies there, to bring foods to these families, provide them with options for housing if needed, and then they work with their local housing places to give students an opportunity, give families an opportunity. It really has to be a wraparound service, and it really has to be all hands on deck.
Before we run out of time again, Commissioner Cardona, when we were talking about, how schools should be responding to cases rising in communities, I know Middletown, the city of Middletown has a rapid testing on-site program that the state is helping fund. And so I wanted to talk with you about, why this is important and how do you expect to expand it to other districts in our state?
Sure. So, we knew early on that building consumer confidence in public education is an ongoing effort. We know, as a father myself, I want to make sure that my children are safe. I want to make sure that the people who I know who are educators are safe. And what we've heard early on is the more access to testing, COVID testing, the better. When this opportunity came up for Binax Now testing to be distributed in different parts of the state, especially for schools, we reached out to different districts and Middletown stepped up. Dr. Connor stepped up and said, you know what, we're going to raise our hand. We're going to pilot it. Let's try it out. So they've been creative and innovative with their partners there, the Community Health Center, to allow for testing to take place in the schools. And they also have PCR testing that's happening. I believe it's on the weekends in the school area for educators as well. Again, part of this is to make sure that you're identifying cases early so that you can quarantine folks so that they're not in the school community if they are either a close contact or if they have COVID-19. And by doing that, you're communicating to the community, we're taking this seriously. We're removing people that might be at risk of spreading COVID-19 so that when you send your child to school, when you go to work as an educator, you can feel comfortable that every effort is being taken to make sure that the learning environment is safe for learning and safe for work.
But with rapid testing, how accurate is that testing compared to the PCR that you mentioned?
So the Binax Now testing, it is a rapid test, but the confidence level in the positives is absolute, right? So if it's a positive, you have COVID-19. If it's a negative, the recommendation from the state health department and the local health department is that you go and get a PCR test. So keep in mind, the Binax Now testing, the one that we're referring to about Middletown, is intended for people who have symptoms. It's not intended for a screening or surveillance testing, as PCRs could be. Binax Now are for people that have symptoms. And if you have COVID-19 like symptoms and you take the Binax Now and it comes out positive, you do in fact have COVID-19. If you have symptoms and take the Binax Now and it shows a negative, the recommendation will be to take a PCR test. But that's a local conversation between the health provider and the patient.
And will this program be expanding to other school districts, Commissioner?
Yes, we have about 20 districts that are in queue to have conversations with their local health provider, because it's not, right now, it's really important that the administration of it follow the guidelines of the Binax Now testing. So what we've done is we've partnered with testing agencies, and in particular, for example, Middletown, it's the community health center there. So they're the ones that are operating the tests. And we're looking to expand it, but it might require that some school systems partner with either a private testing agent or create a system within their district where tests could be done within their district by their school staff, school nurses in particular, not just anyone.
And before you go, Commissioner, we've been focusing a lot on the quality of education for students, keeping them safe. But we know that teachers and other school staff in these schools are just as important. Coming up, we're going to be speaking to an attorney representing a Norwalk teacher who suffers from asthma, and she was told she could not work remotely in that district. Should school districts be making more accommodations for teachers like this one as they do students, Commissioner?
We take very seriously the ADA requirements and the compliance on that. And early on, we that's a non-negotiable, the ADA compliance. I can't speak specifically to this case. I don't know the details of it. But I do know that, as you mentioned earlier, for school systems to be successful, we need to make sure that we're doing everything for our students, but also for our staff to make sure that the environment is conducive to a safe learning environment so that they can continue to be there. And we also know that when we're making mitigation strategies or when we're requiring mitigation strategies in our schools, it's not only for our students, it's for our staff, it's for our staff's family, it's for our students' family. And what we found, Lucy, over the last couple of months is that the mitigation strategies in our schools are working and students are able to access learning in person. And what we can't measure, but it's worth closing with for me, is the social emotional benefit that our students in Connecticut who have had the opportunity to go into a schoolhouse, the benefit that they have had over the last couple of months, there's no way to measure it. But if you recall in the spring how difficult it was for our students and the emotional toll that it took on them, to walk into a schoolhouse now, see kids smiling, yes, it's different. It's not the same. But they're accessing their learning, they're accessing that social network that they have and the relationships. That's a tremendous benefit to our learners and to our employees. And we want to keep that going as long as we can.
Dr. Miguel Cardona, again, is the Commissioner of the State Department of Education. We hope to have you back soon to take more calls and to talk with you further, Commissioner.
All right. Thank you very much for having me. Have a great day.
This is Where We Live on Connecticut Public Radio. I'm Lucy Nalpathanchel. After the break, again, we're going to hear about a Norwalk teacher with asthma who has sued her school district over its remote work policy. You can join us, too. Find us on Facebook and Twitter at Where We Live. This is Where We Live on Connecticut Public Radio. I'm Lucy Nalpathanchel, broadcasting remotely. Most school districts in Connecticut have some mix of remote and in-person learning because of COVID-19. But what happens to teachers and staff who cannot work in a school building due to a pre-existing condition? Some local districts have worked out arrangements for teachers to work fully remote, but that's not the case for a physical education teacher in Norwalk. Now she's suing the school district in what her attorney describes as the first lawsuit of its kind in Connecticut that fights no remote teaching policies. Joining us now on Zoom, Gary Phelan, partner with Mitchell and Sheahan in Stratford and Westport, Connecticut. Gary, welcome to the show.
Thank you, Lucy. Good morning.
So tell us about your client, I believe her name is Amanda, and what she heard from her district when this pandemic began.
Well, Amanda has asthma. Was told by her doctor that she cannot, she's not able to use a mask or a face shield because it will prevent her from being able to breathe effectively. And so Norwalk has, like most school districts, that you have to wear a mask when you're teaching. And so she sought the right to teach remotely as an accommodation under the Americans with Disabilities Act, and was told that there were no remote teaching positions available because the school district had a no remote policy. And that's something that several school districts throughout Connecticut unfortunately have.
Now, when we think about remote teaching, everyone was doing that in March when this pandemic began. So can you describe, as a physical education and health teacher, what Amanda was doing for her students back then and why the school doesn't think that that's possible with this new school year?
Well, like in a variety of subject areas, teachers were teaching remotely. Now they were able to, in the March to June time period, be doing things with. She was able to do things with like exercise. She teaches in the K through 5, so different physical activities that children could do on their own remotely. Exercising, stretching, yoga, meditation. But now that students are back physically in classrooms or in gyms, then there wasn't a sort of analysis as is required under the Americans with Disabilities Act of just her situation. It was just a blanket no remote policy. So she was denied the right to teach remotely.
And you said that there are other school districts that have this no remote policy, but there are school districts that have tried to work with teachers and staff. And again, we should clarify, this isn't just Amanda saying that she doesn't want to work because we're in a pandemic. She has a medical condition that her doctor says she's not able to wear either a face mask or shield.
That's correct. And there was a case, for example, in New York City. And I'm following up on Dr. Cardona's reference to ADA compliance, that's important to them. In New York City, there's actually has guidelines that say teachers can apply to teach remotely if they have certain conditions outlined in the CDC guidelines that place them at increased risk of complications if they contract COVID. That's essentially engrafting onto their policy the Americans with Disabilities Act. What happens is when you have a no remote policy, it's essentially precluding any accommodation, and is the most common accommodation that's been used in several industries, most industries throughout the country, to accommodate people who are at risk due to a medical condition if they contract COVID.
You're hearing Gary Phelan here on Where We Live. He's a partner with Mitchell and Sheahan in Stratford and Westport, Connecticut, as we learn more about a lawsuit by a Norwalk physical education teacher who sued the district because she wanted to be able to work remotely because of her pre-existing condition, and she was told that she was unable to. We did reach out to the Norwalk Public Schools for a statement, and we did not hear back from the district by the time of this show. But I wanted to look at the complaint complaint that was filed, Gary, from the district perspective, they said that the reason they are not able to provide a remote work assignment for Amanda and others is because it would lead to undue hardship. So can you talk about their perspective and, again, how that gels with the ADA and even what the federal EEOC says?
Sure. An employer has to provide a reasonable accommodation for a person with a disability unless it would create an undue hardship. Now, an undue hardship, it will be, in this case, the employer's burden to show. And I think the best way I found to explain the difference is, is it an issue is that the school district, is it because they can't make an accommodation of remote teaching, or they won't make an accommodation? And it really requires looking at each individual circumstance. And that's why here, where they just say, well, you can't, it's really a question of that from our perspective, they won't even try to make the accommodation. And it's why often with the Americans with Disabilities Act, where you have blanket rules, why they are often found to violate the Americans with Disabilities Act.
Looking further at that complaint, I believe the school's attorney, Christopher Sugar, wrote that there is currently a substitute staffing shortage throughout Connecticut, and Norwalk is not immune from this lack of available substitutes. So they're saying that there's just not enough personnel available to accommodate, again, Amanda's request if she's able to teach remotely. I mean, how do you respond to that?
Well, first of all, the accommodation was sought in September. And the response of the difficulty of finding substitutes, was made in late October. If they had made the accommodation back in September when it was sought, it wouldn't be as much of a problem. Secondly, there are options. In this case, for example, if she's teaching remotely, it's very common in school districts where they have a teacher's aide, a college student who is getting credit, in order to graduate, that they be in the classroom. They were much more readily available. And again, the fact that it might be inconvenient or difficult does not necessarily reach the pretty high standard of an undue hardship.
We're in this time of a pandemic where, there are many people who have pre-existing conditions, and, they have to choose between, making a living or their health. And I'm just wondering, you'd mentioned, I believe it's been reported, this is the first of its kind lawsuit in Connecticut. Do you anticipate that there'll be more lawsuits like this, Gary, where people feel like their employers should be accommodating them because of the ADA, because of the fact that they have pre-existing conditions?
I definitely anticipate there will be more. With some people initially file with state and federal agencies, and they have what's called exhaustive administrative remedies. Those, many of them will result in lawsuits. Also, I anticipate there'll be claims filed by people who ended up retiring or leaving teaching because of no remote policies, because essentially where you're telling someone with a medical condition, we are not going to accommodate you with remote teaching, you've just ruled out what is the most beneficial accommodation that could have enabled them to continue teaching.
And so tell us more about how Amanda has been making it work in anticipate of the fact that she can't go in to do her job. I mean, how is she able to continue to pay her bills, and what other remedies does she have?
Well, she right now she's on unpaid FMLA leave. Often with different people in municipalities and school districts, if they have accrued and unused sick time, they can use that bank, and that's one of the things she's utilizing. But again, that's going to run out. And so, like many teachers, they really have a choice of, are you going to teach and take the risk, or be deprived of an income for most of a year, or however long it takes until it becomes safe again for people with medical conditions. But again, this is not a case where we're just saying she's, she really wants to teach. She loves her job. But as is reflected by, municipalities like New York City, to do that, that doesn't mean that school districts can essentially say, well, we're immune under the Americans with Disabilities Act because we really want everyone physically back in the classroom.
We talked about Amanda's pre-existing condition, asthma, Gary, but beyond her doctor saying that she can't wear a face mask or shield, there's also what we know from the medical community about COVID and how people like Amanda are more at risk of when they have this virus of becoming very sick or even dying.
That's correct. According to the CDC's guidelines, someone who has a condition that's identified as being high risk is 6 times more likely to be hospitalized and 12 times more likely to die if they contract COVID. Those are very serious numbers. Now, fortunately, the death rate proportionally is coming down, but it's still obviously high and continues to go up as now we're seeing cases are spiking.
And what does it look like right now in Norwalk, Connecticut with COVID cases, Gary?
Norwalk is also spiking. Several of their schools have gone fully remote. They are on the red alert list that you talked about with Dr. Cardona.
Again, you're hearing Gary Phelan, partner with Mitchell and Sheahan in Stratford and Westport, Connecticut, as we hear again about this lawsuit filed by a Norwalk teacher over the district's no remote teaching policy. Coming up after the break, we're going to hear from a reporter with Education Week about how school districts in other states are handling requests from teachers in the pandemic. You can join us too, 888-720-9677, or find us on Facebook and Twitter at Where We Live. This is Where We Live on Connecticut Public Radio. I'm Lucy Nalpathanchel. Coming up tomorrow, COVID cases in Connecticut continue to rise, and the majority of residents now live in so-called red zones. On the next Where We Live, Governor Lamont has ordered a voluntary curfew and is requiring restaurants to close by 9:30 p.m. But what will this mean for an industry already on a knife's edge financially? And with winter approaching, is there a way to enjoy restaurant dining indoors safely? You can join our conversation. That's tomorrow. Now, my guest is attorney Gary Phelan, who told us about his client, a Norwalk physical education and health teacher who's suing her school district for not allowing her to work remotely despite having a pre-existing condition. We wanted to know how other school districts around the country are responding to these requests from teachers. Joining us now on Zoom is Madeline Will. She's a staff writer with Education Week. Madeline, welcome to our show.
Thank you for having me.
So I wanted to find out from your perspective, how are school districts accommodating teachers? What have you heard?
Yeah, so there's been, the Kaiser Family Foundation estimates that 1 in 4 teachers have a high-risk condition that puts them at high risk for COVID-19. So school districts across the country have seen a uptick in teachers requesting accommodations to work remotely. And in some cases, that has put districts in a tough spot of we need to maintain staffing levels on campus while also trying to accommodate as many teachers as possible. So districts have had to either find creative workarounds if they can't grant teachers the exact accommodations that they have asked for, or in some cases, school districts have not been able to reopen at all.
Now, knowing what Gary has told us about the ADA, I'm just curious, are there other cases where we see districts, despite teachers having a pre-existing condition, telling them you can't work remotely and there haven't been any accommodations made? Are other lawsuits being filed?
I have heard of lawsuits in several different states, including several in New York State. And Palm Beach County, Florida, teachers asked a judge there to allow teachers to work remotely if they felt that was necessary. The judge said there was no legal right to work remotely and that it would be an overstep to close the schools down for that request. So I think there are some cases where the judges have shut down those lawsuits, and then several others are still playing out in courts.
Gary Phelan, could you respond to what Madeline just told us about what's happened in other states and with judges making these decisions?
Yes, I'm going to talk about 2 cases in particular. One is in a lawsuit filed in New York City, challenging their policy with respect to remote teaching. But what they were saying is that remote teaching shouldn't just be limited to people with medical conditions or what the ADA requires, that it should go beyond that for example, people who are, have family members with medical conditions where they would be, exposed to greater risk. And the court said that the ADA doesn't require that, which is true. And so, but that doesn't mean the accommodation of just for the individual teacher wouldn't be enforceable. Another case was in Boston, where there was a lawsuit filed by the union challenging returning to the school district for high risk learners. And in that case, the court held that there wouldn't be, teachers weren't required to return. Again, it didn't focus on the Americans with Disabilities Act. It was just basically a general safety argument on behalf of all employees or all teachers. I'm not aware of any decisions yet where specifically a teacher seeking an accommodation under the Americans with Disabilities Act, where a court said, no, you're not entitled to it, where it deals with remote teaching.
Gary, I'm glad you brought up unions. Madeline, how are unions around the country responding when they have their members, their teachers that have these pre-existing conditions and are trying to be able to work remotely, and those requests have been denied?
Yeah, teachers unions across the country, and some have brought lawsuits on behalf of those teachers. Others are trying to negotiate with the districts and set up a policy for teachers who are at high risk.
And so they're trying to put this into their collective bargaining agreements. Is that an approach?
Exactly, yes.
Gary, you brought up earlier this point about, we don't know yet how many teachers have had to retire early in this pandemic. And so I wanted to hear from you, Madeline. What do we know in terms of teachers who've had to give up their careers in this pandemic because they may have a pre-existing condition, or they're of a certain age where they're at higher risk if they get COVID, or even if they live in a household with a child or spouse who's at higher risk? What do we know about how many teachers are retiring or leaving the profession?
Right. So in the summer, there was a lot of talk that there would be a huge wave of teachers retiring or resigning because of the reasons you mentioned. But Education Week, we did an analysis to try to find data to support that, and we couldn't find it. It really varies from place to place. In some districts, maybe some states, they've seen an uptick in retirements, but in many other places, it's flat or even down. And we talked to experts who said, the economy is not great right now. A lot of teachers just can't afford to give up their jobs.
Gary, did you want to add more to that?
Well, I would echo that a lot of teachers are, because they can't afford not to work, despite the high risk involved, they are continuing to do their jobs. Also, a lot of school districts are willing to offer remote accommodations. So it's not necessarily the fact that every school district, is implementing a no remote policy. And, I think that one of the things I think is discouraging is, the technological tools out there that are being utilized, such as Google Classrooms and for a wide variety of areas, that, schools had the experience of utilizing them in the spring. Now that experience is being essentially disregarded with a no remote policy, because technology is the key component of accommodations related to COVID. And here, many school districts are just saying, we're not even going to consider that.
Now, we talked about cases going up in our state, Gary, and then we look at even the western side of our state in places like Norwalk. What would happen for your client, Amanda, if the school district had to go full remote? What would that mean for her job?
Well, ideally, I think that they would ask her to teach. Whether or not that's the case, I'm not sure. But again, as school districts start to go remote as the cases spike up, that certainly may be one thing that we'll start to see.
Now, we're talking to you about this particular lawsuit that you filed on behalf of your client, but maybe explain to us, Gary, because of these situations, the administrative remedies that need to be exhausted before an employee can even file a lawsuit, the process that can take many months.
Sure. What in most cases, what individuals have to do is file a claim with a state and federal agency, and it has to stay with the agency for at least 6 months. What's unique about a school district is they are a federal fund recipient, and there's the Federal Rehabilitation Act that gives them the right to go to court immediately and not necessarily have to exhaust administrative remedies. That's what we're relying on in this case. The Rehabilitation Act is essentially the foundation of the Americans with Disabilities Act. It took the Rehabilitation Act and expanded it to the private workplace.
I want to fit in a quick call. Rebecca from Rocky Hill, we just have 2 minutes. Go ahead with your question.
I'm thinking that one reason that we don't have so many teachers admitting they're retiring now is they're waiting to see how things play out, partly because if you're high on the pay scale and you retire now, you are probably never going to get hired as a teacher again. And in 13 states, whether you take another job or not, you're not going to get Social Security. We're not eligible for it.
Gary, do you want to respond?
I would agree. And, certainly what many school districts are doing that have no remote teaching policies are saying you can take a year off. We're going to give you a unpaid leave of absence for a year and then come back. And things may be a lot different. In a year from now, the problem is supporting themselves during that year.
And that is something that Norwalk offered your client, Amanda, that she could take that 1 year unpaid leave.
Correct.
Madeline Will, who's been with us again, staff writer with Education Week, what will you be watching for in these next few months or longer in terms of, districts accommodating teachers, because this pandemic is far from over?
Right. Yeah, I think it'll be interesting to see how this lawsuit and others play out, if these teachers are granted accommodations. And like the caller said, what retirement numbers look like next year or as this pandemic progresses.
Gary, before we end the show, again, this lawsuit was filed recently. What are the next steps? What's next for Amanda?
Well, as we proceed with the legal process, certainly there's always the possibility that we could reach some sort of resolution. Again, a lawsuit is really a last step. Ideally, reasonable accommodation is about negotiating and reaching a solution that all parties can live with. Perhaps that'll happen in this case. We certainly hope so.
And can I ask, are you hearing from other teachers?
Yes, I've heard before and after of teachers who are also navigating no remote policies.
Well, we hope to speak with you in the future, Gary, to find out how this is remedied for your client, Amanda. Gary Phelan, again, is partner with Mitchell and Sheahan in Stratford and Westport, Connecticut. Gary, thank you.
Thank you.
Also with us today, Madeline Will, staff writer with Education Week. Madeline, thanks for joining us.
Thank you.
Today's show was produced by Tess Terrible. Our technical producer is Kat Pastor. Carmen Baskoff was on the phones today. I'm Lucy Nalpathanchel. You can download Where We Live on your favorite podcast app, and we hope you join us tomorrow.